Local clinic is offering hope to people who have suffered certain kinds of nerve damage. Today we're back with Dr. Darren Scott talking about peripheral neuropathy. Thanks for being here today.
Yeah, thank you.
Well, it's a mouthful. Let's talk about what it is and how someone knows that they might have it.
Yeah, neuropathy is basically nerve damage. Generally starts in the hands and the feet. And the symptoms can vary depending on the type of nerve that's being damaged. But traditionally, if you have numbness, tingling, burning, sharp pains, that's usually a good indication you might be suffering from neuropathy.
It sounds like symptoms for a lot of other things, like if somebody is diabetic and they're having complications from that. How do you know it's nerve damage versus anything else?
Yeah, that's a good point. First you have to find out what the driving cause of that symptom is. Yeah, diabetes is a big one, but even research now, it's when you're insulin resistant is where the damage really starts instead of waiting for your diabetic. But there's a host of other conditions, even an old back problem from 20 years ago, that scar tissue, or a pinched nerve in your back, autoimmune conditions, even a food sensitivity like wheat, for example, can contribute to neuropathy.
So it sounds like a smorgasbord of things that could be attributing to what's going on. At what point should someone go to their doctor and say, okay, I've been dealing with this tingling sensation, I haven't felt great in a long time? When should they go to their doctor and have that conversation?
The sooner the better, obviously. A lot of times they'll go, and traditional medicine doesn't really tend to do a lot for it. They'll do some medications to try to help the patient cope with it. But generally there's a lot that can be done, but you have to first find out what's driving the condition and then support that condition so it doesn't come back when you help restore the nerve function.
If I walk into your office and I say, Dr. Scott, help me out, what kind of treatments are available?
Yeah, so what we do is first we want to find out what is the underlying cause. So we have to do a lot of blood tests or saliva or stool samples to find out what the metabolic cause is. Then we have to find neurologically what could be damaged. And so we do a system called a Toronto Clinical Scoring System that determines how much nerve damage that you have. We'll give you what they call a neuropathy score, because a lot of patients like, how bad is it, what nerves are being damaged, and we'll give them a scoring system, and then we use that to track their progress. But yeah, there's a lot of devices that we use, like cold lasers and electrotherapy, to help restore that nerve function.
It sounds like something that can vary, that there's no one-size-fits-all for patients who walk into your office.
Nadia, that's exactly right. I mean, really, that's a lot of people, they try to address it by doing a cookie-cutter kind of approach, but given one particular patient can come in and they may have blood sugar problems, but they will have high cholesterol and have a back issue and have some other issues that are driving that problem. So we have to handle the whole cog of it, not just those one individual parts that we want to work with. We have to do the whole thing.
Yeah, so sounds complex. That's why you're the doctor. We come to see you. At what point should someone give you a call? Who do you want to see? Who are the best people, the best candidates for getting treatment?
Yeah, if you want to see if you're a candidate for our program, we are running a special for the first 20 patients or 20 people that want to see if they're a candidate. It's a $60 charge, and that gives them 2 visits to see if they're a candidate or not. We can't help everybody. Usually if you have over 85% nerve damage, there really isn't a lot that we can do for you. But yeah, call our office. The sooner the better, because the longer you go, it's progressive and it becomes permanent, where you're over that 85% now, nothing can be done. You just live with it.
Early detection, early treatment is key. Dr. Scott, thanks for joining us today.
Thank you.
We'll put those details on our website at goodforutah.com.